Hi, this is Graphically Alex coming at you with all things fat related. If that's something that interests you, please subscribe. I'd love to have you. Today we're going to go ahead and finish this episode. I just have a couple of announcements to talk about. So I randomly have started getting up a lot earlier. It's been super disruptive to my life. So as you can see, I'm filming in the day. Luckily I can today because I'm just trying to get everything done before night because I don't know what's going to happen tonight. Because I keep getting tired and all this stuff. So I'm going to go ahead and do this now. So just know I don't know what's going on with me, with my body, all of it. It's changing drastically all of a sudden. I'll see how my weigh-in goes tomorrow. You guys will find out if it's good or whatever. And we'll continue on basically. So, or not tomorrow, but my tomorrow. You guys will probably know now if something happened because my weigh-in day is Thursday. But anyways, let's go ahead and get into this. I also want to say too, I really do, my MSP, my mid-sized princess energy, it's not dead, but it is dying. I have moments now, but I also have a lot of confidence a lot of the time. And I definitely was having confidence this morning, and I'm okay, because something kind of happened that I think typically would have made me really, really upset. And it didn't. I'm not happy about it at all, but it's I didn't crash out or anything, and I was I think I can rise above these emotional reactions and stuff and see things from another person's perspective, and I don't know, I just think I'm getting better. It's having more empathy, having more understanding, having the ability to not jump to conclusions or to not freak, I think is really new for me, and it's definitely a sign that MSP is dying. So it is very much dying. I still think that I'm in between the mid-sized princess era and the vanity weight era. I'm in between. Still, I'm not fully in the other one yet. But I was just very tired yesterday from the gym. And that's a little bit different as I'm trying to build muscle and get to the point where I'm done building muscle for the rest of my weight loss, which I'm almost there. So I was struggling, especially with my lower back, because I just finished my lower back and it was really hard. So anyways, all those thoughts aside, let's go ahead. Ooh, I just picked a scab on accident. Let's go ahead and get started. So anyways, those are my announcements. Oh, okay, we have a nice ad. 1 second. Okay.
Rebecca, what's up?
Rebecca, what is
man?
up? I do want to say to our visual watchers and our audio listeners, you probably haven't heard me much today, and I am a little detached from the world at this moment.
I see it.
Yeah, so apologies. I am here, and I have been listening. I just am struggling a little bit. I think first I got really overstimulated while we were recording, and then I just have been struggling a little bit to stay present. As far as what's happening in my life, I did go see a psychiatrist to talk about some concerns my therapist had around depression and potentially ADHD. The psychiatrist was very much you don't have ADHD. That's not what's happening at all here. She thinks I'm having depressive episodes that are affecting my focus and ability to do things, ability to do what I want to do. So I started a new medication a week and a half ago, and it is a medication that can also be used to treat things like bipolar and BPD. Mm-hmm. And so one of the things my therapist was worried about is this thing called cyclothymia, which is basically bipolar but in smaller doses. It's just that you do have a cycle of depression and mania, just at a lesser degree that might not actually get the bipolar diagnosis. And my mania, if it is mania, the psychiatrist does not think it is. But if it were to be, it's that I get overproductive and I work all day long. But she thinks that is not the case, that I am tired when I'm doing that, and that I prefer to stay in a productive state. So anytime that I'm not productive, I am depressed. So the medicine is supposed to help with depression in conjunction with my anxiety.
What do you think?
I think I'm willing to give it.
To me, that sounds like it is dopamine issues, which they don't want to ever acknowledge, but they do exist within obesity. I've talked to you guys a lot about that. Even as I've been downsizing, I have similar feelings to that. And I think that that's a common feeling within downsizing, especially at lower levels. I think just when you're bigger, you just have a lot of problems. And I feel like this dopamine issue, it kind of takes a background approach, but it comes to the foreground as you downsize. And there's been a lot of times that I felt that way, where if I'm not in motion, then I get really sad or depressed, and it has to do with not having enough dopamine or needing to be chasing something or going towards something. Otherwise, you feel depressed, you feel listless, you feel like all these things, which, again, I know that they don't like to acknowledge the obesity in the room, but you're only ever going to be so good when you're super morbidly obese. It's never going to be okay. And I think that that's something that people need to understand. And that's a huge part of why I'm not a proponent of fat acceptance whatsoever, because accepting fatness, accepting super morbid obesity is often accepting low dopamine issues. It's accepting depression. It's accepting anxiety. It's accepting hypothyroid symptoms. It's accepting lack of mobility that's unnecessary. It's accepting lower dating options, or having fewer options in that. It's accepting a lot of different things, both physical and social, that are just not of any benefit to anybody. And your quality of life, it goes deeper than just the physical. It's also mental. It does affect your mental quality of life. And I can tell, like, my dopamine issues, they're still there. I do think that some of Mid-Sized Princess energy has to do with low dopamine. The way that I would describe the difference between like small fat and Mid-Sized Princess is basically, in small fat, you have higher estrogen still. So it affects you differently. Like for me, it made me feel like I was drunk all the time, basically, which alcohol is estrogenic. So it's kind of similar to that feeling a little bit. We have similar hormonal pathways within obesity to alcoholism, for example. There's a lot of similarities. I think that's why a lot of people find them to be similar, and why there can be a lot of overlap, basically, between these two issues specifically, because there's a lot of hormonal overlap. So regardless, with my bra era, it was like a high estrogen, low dopamine, which was insane. It was intense, but the only way to get through it was for me to just keep moving. Mid-Sized Princess, it's like high testosterone, lower estrogen, but low dopamine still. So it just leads to a lot of feelings, like on a physical level anyways, which doesn't happen to everybody. But if you're dealing with hormone recovery, then you're having these low dopamine plus higher T, which makes you really petulant, impatient, frustrated, right? Mad, all that type of stuff. So that's where a lot of those feelings come in. And it's challenging within downsizing. Like, even if she were to downsize, she would still struggle with this for quite a while. And it does tend to get worse in a deficit, especially if you're eating lower carb and stuff like that. It gets worse. And sometimes you have to, like I've had to lately, because like I could tell I needed fat yesterday, so I had to be lower carb because I still have to get my protein in because I'm building muscle and all this stuff. You see, it can be challenging. So I understand it very well. I don't get as bad now. I still think that for me, at least, the dopamine issues were the worst at the gateway to class 1 obesity. So right as I was getting to that point of getting out of obesity period, that's when it was the hardest, and that was in March. So if you guys remember me in March, it was really, really, really hard. I had a total MSP crash out in March. I had another one in June though, which you guys handled it really well. I was so nervous that you guys would judge me and stuff, and you guys were like, I totally get it. And that was like kind of nice. I think that's a nice thing about MSP is it's common. So you guys got it, which I appreciate that, because I did feel crazy in June, like when I was crying on the way to the dentist. I mean, it's like, this is not a big deal. And I knew it was stupid, but I was just so, I guess, like frazzled, you know, by everything. So yeah, and it fluctuates too, you know, it's tricky. Because for a while my dopamine was feeling better, and then now it's feeling worse again. But then now it's also feeling better. Like, it's just weird. It's really weird. There's a lot of shifts, you know, because now I'm getting up earlier and like everything changed again. It's frustrating, you know, but I can tell, like, getting up earlier, my metabolism is stronger and my testosterone is higher, and all these different things are better, but it's also like, whoa, like, what am I doing? You see? So I think, like, within downsizing, there's a lot of fluctuation. I think medication is something that has to be considered and adjusted throughout the process, typically. At least considered. You have to, like, think about it, because it could have a lot to do with the weight itself that could be affecting you mentally. I think in their case, they're not necessarily downsizing. It's just the state of being super morbidly obese is enough. And people also have to remember that being super morbidly obese is a lot on the body and the mind and the brain. It's a lot. So again, I would really hope that her psychiatrist would suggest to her to downsize, but she probably won't, or they probably won't. And it means that the issue's never going to actually get solved. It's never going to actually happen. So they might be able to somewhat manage it, or it might be a little bit of relief. But when you're super morbidly obese, like they are, there's no easy way. And even getting out of it, there's going to be like a hit to the dopamine, basically, for example. Like, that's going to happen, especially if they're already having issues just being in a state of being. So I think that that's something a lot of people don't want to acknowledge about downsizing, is that when we do downsize, some of our hormone situations do get worse, but it's like an investment. So it's like downsizing is anti-thyroid. So if you're hypo, it feels worse when you're in a deficit. Downsizing is anti-dopamine. So if you have dopamine issues, it gets worse. But that's why you have to do things to try to counteract. And people don't think of it that way. They think of things in isolation. And when it comes to downsizing, you cannot do that. You have to look at a whole picture. And we just don't do that in American medicine at all. We don't do it culturally. We view each part as separate. And I don't think it's wise. And I think that that's why we have so many issues with obesity in the United States, because of the way that our medical system is run. It's run extremely, like, every single piece is an individual piece that has nothing to do with anything else. So just to be clear, I'm not necessarily against medication. I know that that can be taken that way, but I am skeptical of it, if that makes sense. I don't think that it's good all the time for everybody forever. I don't believe that. And I think when you're looking at something as physical as supermorbid obesity, you cannot ignore that elephant in the room. When it comes to a discussion about these medications, you can't. Then remember that fat is hormonally active. It is affecting your brain, just as it's affecting every system in your body. And it is a huge part of the context, which we need to have more contextual medicine. People need to be able to understand that, for example, if you have liver problems, you're not going to be able to convert Synthroid as well. So you might have to take a different thyroid medication. Like, in doctors in America, they don't think about stuff like that. It's like they can look at a patient, see the patient has a bad liver, but they'll still give them the Synthroid because the insurance says to give them that. But it's like, it's not going to do anything because their liver can't do it. You see? You have to look at everything. And I'd say that that's been the best thing in terms of my downsizing journey, is looking at everything holistically. It wasn't just my diet and exercise. It was also my lifestyle. It was also living in a way that was completely inauthentic to me, or living in a way that I didn't like. It was living in a place I didn't like, right? It was all of these things all combined. And in 2021, I changed everything at the same time. And then I started to get better, because it's, being in complete isolation, for example, it's extremely stressful for us as human beings. And I had to change that. So I had to move. It's like, but you have to do things in order to get better. And people don't want to have those conversations. And that's even outside of the toxic ritualistic. But if you're within it too, you have to fight that too, because that's a mental health issue. So it's a lot, and it's a lot to think about, and it's complicated, yes, but it's not unsolvable. That's where I'm always like, when people act that way, because you can't act like just because something is difficult or complicated, or just because you have to figure something out, that means that it doesn't matter or it's impossible. That's not real.
I don't know what ADHD is. I don't know. Obviously I see y'all's brains. My brains function differently.
I don't think you have ADHD.
Yeah, my brain functions differently.
Not that I'm a doctor.
But, y'all also have other stuff going on, so I'm kind of like, do I have ADHD? She's paired with other things,
She's like, not like us. I don't think you do, because, I think you could see it sometimes in the way me and Allie talk. Like, we really jump.
Yes.
All over.
Yeah.
It takes such a little thread to connect those thoughts. Mm-hmm. And you are from point A to point B, you are very well connected.
Yeah.
I don't think me and Allie are always that.
I struggle, kind of this episode is what happens with me. I struggle to stay mentally there. And I often find that with work. I struggle to read a bunch of essays and give them feedback. And I struggled with it today. It wasn't that I wasn't listening. I had a hard time being active in the listening. And there were times where I really had to push myself to stay active in the listening. And so I think that's what scares me. Now, what she said is that sometimes when you have prolonged depression, it actually can affect that.
Yeah.
So she does think that there's some kind of seasonal depression to me, which I agree. It tends to be my down months are December through March, December through April.
She could have some hypo going on too. That's also a factor. Very common within supermorbid obesity, especially if there are seasonal factors. I've talked about that a lot on this channel, to death even. And it is a major aspect for a lot of people who are supermorbidly obese. Your worst times tend to be around the solstices. So even right now, it's tough, especially if you're in a deficit. It can be really, really difficult in the height of summer or in the height of winter. So around January, December, June, July, it's tough. Those times are tough. If you're very hypo or if you're downsizing, it's harder than April and October. Those are easier times. It's something to consider.
And so yeah, we're gonna see how this medication goes. It did cause a couple days of insomnia. I've changed when I take the medication. That seems to have helped.
Good.
But yeah, and she also thinks my anxiety is not fully, medicated. And the thing is, I'm at the highest dose of what they typically give. She said it's not that they don't go above it, but that I am at the normal highest dosage. So we're gonna see how this medication goes. And
I think that at a certain point, you have to understand that your obesity is contributing to it. And a medication is not going to be the be-all, end-all for you. You need to deal with the obesity. That's a major aspect that is being completely ignored.
All I can say is we're going to see how the medication goes.
Yeah.
So I don't feel bad for taking medication. Give me more pills, honestly. Honestly, if I didn't have to deal with my problem, I could just take the pill, I would take the pill. You know? And the thing is, though,
better living through pharmaceuticals.
I mean, listen,
Yeah, it's very Americana. It's kind of cringe. To me, that was kind of American cringe, a little bit. So it's like a pop the pill, don't do anything to make a situation better, don't work towards any solutions, just try to take the easy way out kind of vibe, which, again, I'm not anti-medication, but medications often have to be taken in tandem with other steps. So if you're not willing to take other steps, it's not going to solve the problem. It's not magic. And to me, that is American cringe, what they just said. That was very cringy to me.
Went on a date, and he let me know he's not into, like, he had a different view of medication. Hi, you're probably watching. You thought you were going to end up on here, and you already are being talked about, sir.
We've heard some things.
We have.
Hi.
We've heard some good things.
We've heard good things.
Yes.
We've heard good things.
But he doesn't get his name dropped on the podcast yet.
Not yet.
Not yet.
No.
That's too much of a hard lunch
No,
for
and
Rebecca.
we were definitely doing, like, we talked about, like, expectations, and we're both just want to have fun right now. So, like, this is not immediately going to someplace serious.
Sorry, keep going.
I actually don't know where my thought was, so.
I wanted to say something about the anxiety, and we don't have to keep this in, but this is us just, like, talking as friends.
Yeah.
I know you've pulled back a little bit from therapy because you weren't feeling good and all of that, and then I also get, like, the capacity. I'm wondering if maybe it is time for a therapist change. And maybe trying to focus on someone who works with high anxiety patients. This is where we were talking, right? I think you need more tangible, like, tools that are not medication to pair with the medication. You need medication. Let me be
Even
clear.
she's saying that. Gosh, if even somebody's saying that on there, wow. I'm kind of surprised that Alyssa said that. I'm a little shocked. Wow.
Right? No. I need medication.
Girl, same.
You need medication. Like, there's a
absolutely
level, right? When it's consistent and it shows up, right? I don't mean that as a negative thing. Taking medication's not a negative to me, right? But I do think that you were finding that, like, the fan, the cool air, the ice, like, those things are helpful. There are so many other tools. Those are just, like, mine. You tend to, right?
Downsizing, for example, might be a tool. You keep saying it.
Started with ones that you've seen me use. The first thing I do when I'm feeling uncontrollable anxiety is get an ice pack in my cold water.
Yeah.
Like, that's the first thing. The fan, oh my God, those are baseline, you know? But there are other things too that can really help, that might speak more to who you are and what you need, that could be helpful. Again, I'm not saying you can't get that with your current therapist, but I do know that you've been sitting for a while that you just didn't know.
No, we only went down to 2 every other week because I didn't feel like I had stuff to talk about.
Okay.
Now, I don't think, I'm going to be honest, when I went to go see the psychiatrist, she asked me how I felt about a lot of things, but then when it came to weight and weight loss, she did not. And she just was like, congratulations on, like, you know, like, because I was telling her my history of things. Oh, you've had weight loss surgery, congratulations. And I'm like, this is why this girl's not my therapist.
Yeah.
Oh,
You know?
I do not like psychiatrists
Yeah.
because of that.
Yeah. So I think that I actually trust Brittany a lot to be my therapist.
Yes.
Would I maybe pair that with someone else?
So
Maybe.
awkward. Just so awkward. Oh, gosh.
My initial thought as you talk about this is like, no, girl. Brittany's my girl.
Good. No, then you should stick with Brittany.
Yeah. But yeah, I mean, I think even like that conversation feels overwhelming to me right now, if I'm being honest, just because I don't feel centered enough to like talk about it. So I am like facing the end of the semester. I'm overwhelmed. I have faculty meetings that are not going well. I'm unhappy in my job. It is not feeling like the win for Rebecca episode update, you know?
Gotcha.
And so I think I'm exhausted, and there's so much going on. I'm very much looking forward to summer.
Yeah.
I'm looking forward to my summer break. I'm looking forward to some stuff we have planned with Charlotte Plus. I'm looking forward to the beach. And in my mind, I just have to get there.
Yeah.
And if I can hold on to get there, I will be okay. And so I just need to get there.
El sabor sabroso de Luisiana y el crujiente.
Baby boy.
Lumpy's got an update.
Lucky got a cough. You want to talk about? That's my update for today. And listen, on other days I yap, and today's just not a yap day for me. And that's okay. That's okay. Tell us about Lucky. Let's finish out with Lucky update.
Yeah, give us a lucky baby.
Give us a lucky pup.
He's okay.
Lucky's okay. No, let's not panic. Let's just send some good vibes towards Lucky. Lucky is old. I feel like we have clarified this. Lucky's an old man. He's 13 this year, or 14 this year. I don't know. I really stopped counting. Like after
What is age?
After 11. After he hit 11, I was like, okay. Yeah. So we brought Lucky to the vet a while ago because he was coughing. Which I'm sure you guys have actually heard in some episodes. I think he's like hacked a lung and Rebecca's like cut it out or something. But he started with this weird cough and we're like, oh, weird. So we brought him to the vet because we're very proactive parents. And they were listening to his heart and they heard a little murmur. So they were like, we want to, figure this out. So we go, okay. So we set him up for an EKG. He just had his EKG done this Tuesday. They shaved his little belly spots to put the little pads on. And this is the weirdest thing, okay? The vet calls me and the vet goes, so good news. And I instantly go, fuck. When you start it with good news, it means that there's bad news.
Yeah.
I'm like, damn it. So I'm sitting there, I have my little Post-it note, and like, first things first, if you have to talk medical stuff, you start with the people who understand medical stuff, right? Like, I listed Billy as the person to call. Billy will call me and explain it to me. Me explaining it to Billy is not the road to success, okay? Fair. So she was like, I tried Billy first, he didn't answer. I was like, okay. So I literally am sitting there ready to write everything down. So they listened to his heart. Yes, he has a little murmur. They explained it to me in a way that you have different valves to your heart, or there's like 4 valves. One of his valves, which happens to people and dogs, is pumping a little bit slower, and that's due to age. Everything else looked great, and there is no medication needed. I went, that's great. And she goes, so weird thing. I was like, no, stop it right there. Stop it right there.
I need you to hang up now.
She said the weird thing is, while they were setting up for his heart, they happened to find a 9 centimeter in diameter.
Yeah, that's crazy. That's fucking huge.
Like lumpy, fluidy thing in his chest area. And I went, okay. And she went, so there's 3 things it could be. One, it could be an object that got like rerouted and got stuck there and has like a liquidy pouch around it. Or it could be like a plant-based product. Mm-hmm. That's literally what it said, plant-based product. It's okay. Or it is a fluid mass or something. So basically, it is not the heart murmur that's causing the cough. It is most definitely this fluid mass thing that is. Now, there are a lot of things that this fluid mass can be if it is a fluid mass and not an object, right? Of course, one of those things is cancer, but there are a bunch of other things. So we're not jumping to worst case scenario. Lucky is still running and...
You're like, I hear you talking about me. I'm waking up.
Oh, what a baby. He is still running and playing and swimming and eating and drinking and living his life. Nothing has changed personality-wise, so we don't think it is anything super serious. Of course, we're treating it like it is. He's gonna go get it. He's cracking me up right now.
I do love having Lucky in the studio with us. Although, as I'm saying that, my brain just went to a really dark place and I can't get it back. I'm just imagining the day that like we have like an episode and it just in the arms of... I have to tell you where my brain went. Please don't be so fucking flabbergasted.
Look, that's how he feels about it.
Same.
Awkward. Very awkward.
Sarah McLaughlin are really upset about this.
Lucky's like, listen here, bitch. I'm gonna be here for a while. Oh.
Yeah.
Oh.
Okay.
Lucky's okay. We're gonna do the X-ray, and we'll get some feedback from there and figure out what we gotta do. But they might need to sedate him. And the first thing I said was, "Can you also chop off the skin tag?" I mean, if they do,
It's getting caught up on itself.
they-
It needs to go.
Trip on.
if they do sedate him, I'm gonna be like, we also need to take care of the skin tag while we're at it.
Yeah.
They didn't have to sedate him for the EKG, which is why it's still hanging.
It's hanging out there, baby.
Anyways, that is Lucky's update for the podcast. And I feel like we're going to wrap it up because our friend Rebecca is chugging along here, friends.
As Alyssa says, I'm
She's bored to death. That's how I would say it. I wonder if they're going to be back. Do you guys think they're going to be back? This was, I think, over a month ago. Do you think they're going to come back? That's my biggest question. I wonder if, to a certain extent, the podcast just kind of spun itself out, or they just didn't have anything else to talk about. This whole episode was kind of weird. I feel like they just did something just to do it. And I feel like Rebecca was bored out of her mind. I feel like Allie was irritated a lot of this episode, and I feel like Alyssa was just kind of nervous, very nervous the whole time, and she kind of talked a lot, and I think she was trying to like be a good sport type of vibe, but I just don't think it quite worked. And so I just wonder if there's really just like a lack of chemistry at this point, or there's just nothing going on, and I wonder if that's another reason why Allie left. Because it's just not giving. It just isn't it anymore. And it sounds like they're all having escalations of health issues. They're all having escalations of physical and mental health problems. With Alyssa needing a CPAP now, Rebecca needing more medication. What she's doing is not working anymore. And Allie, I think, somewhere in between, or she has both issues going on, where mentally she's not all there, and physically she might be getting worse too, as she was talking about going to the hospital. So I agree with a lot of you guys that talk about fat acceptance and talk about these things, and you say like it will never gain complete traction because people that are in it, they eventually fall off, which is true, but it can do a lot of harm on the way down. And there's a lot of thin people that push it too, that they'll go on for a while talking about it, and it's always very targeted towards overweight people, especially super morbidly obese people. Like, fat acceptance is extremely targeted. Remember that toxic ritualistic reinforcement, it's not designed for general population. It's designed for people with these issues specifically. So it's not a matter of trying to convert somebody to having a toxic ritualistic issue, aka you fall by the letter D. It's a matter of keeping the person in it. That's what the point is. The point is to keep somebody in it, because if you keep them in it, then you don't have to get out of it either. It's a crabs in the bucket type of thing. It's competitive. It's a lot of stuff. And it does go across different ones. So even people that are on the reductive side of things will feel a sense of competition towards people on the BINGE side. So I think that this issue is still important, regardless of if people kind of get too tired to continue. There's always more people coming in, and again, it's institutional, so it has to be fought still. But with that, you guys, I'm going to go ahead and go. I guess today's was a little bit shorter, which is okay. I will talk to you guys again next week, and I'll see my members tomorrow. We're going to be doing that Jubilee, which I hate for members. So anyways, I will talk to you guys later. Bye.